So let's talk Botox. Who is Botox for? If you keep doing Botox, do you always have to do Botox? And if I don't do Botox, how will it affect me in the future? Many questions I get asked every day, so let's just talk about Botox. So Botox can be used as a prevention. So even if you don't have those lines on your face, you actually want to do Botox before you get those lines. Because those lines at rest is just what's called a passive line. And those lines, when you make your facial expressions like this, and it forms these lines and number 11 lines, those are actually your active lines. And those are the ones that we inject Botox into those muscles. Those are your facial muscles of expression. So it helps weaken that muscle so that contraction or that squeeze that you make in the muscle is not as defined. If you already have those lines that are created, Botox will still help reduce the effects of those lines, but you may have to have additional treatments such as fillers or smooth filler threads that will actually fill in those lines that you've already created. So that's in my case, someone like me that did not start prevention Botox as soon as I should have. So before I get my next Botox, I'm way overdue. I'm going to show you some of the most common places that we treat for Botox. The other thing that I get asked before showing you that is, well, my last provider used just this many units, or this provider recommended that many units. So when you come into consultation with me, what I will tell you is what I think that you need to get what's called full correction. That means to get the desired effect that you're looking for. I understand sometimes that people may not have the money that they need to get the full correction, but I always advise them to save their money. It's better to get the full correction as opposed to take a few units and not really see, and then maybe not be as overjoyed by what Botox gave you. So let's talk about Botox and full correction. So we inject this area of muscles with usually 20 units of Botox is what you need. As you inject that muscle, these muscles bring down your eyebrows. So you'll naturally get a lift in your eyebrows when you put this muscle at rest for a small amount of time. The second most common place is our crow's feet. These are our smile lines, okay? I love everyone to have expressions. So when you get your smile lines injected, it doesn't keep you from smiling. It doesn't make you have that poker face. It just softens those lines that you get over on this side. When you're treating crow's feet, the most common amount that you use here is 15 units, but it could span all the way up to 20 units, just depending on what the patient's needs are for full correction. Now we all have these lines in our forehead when we raise our eyebrows. You see, you get these raised lines. As far as the forehead lines, it starts off at about 10 units of Botox. Occasionally you'll need 15 units, just depending on what the strength of your muscle is for you to get that full correction and that look that you're actually looking for. I don't choose to treat those lines because my forehead is not very long. So when I treat these lines, it sometimes gives me a heavy brow. So I choose not to have that heavy brow. So I will just go ahead and have these few lines there. Those lines don't bother me. I mean, I'm 54 years old, so you're going to have lines that you've created over time. So come in for your complimentary free consultation and have a great day.